How you gonna pay for it? 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 How you gonna pay for it?
In case you don't understand, he's saying, how are you going to pay for it? The context here is that Kyle, like many other online leftists, get annoyed when the media asks progressive politicians how they plan to pay for their policy agenda.
How many times have we heard this? When Bernie ran, we heard it roughly every 7 seconds. You want to do good things, bro? How you gonna pay for it? And then meanwhile, when bad things are proposed through Congress, the pundit class is like, shh. Of course we can pay for it. Shh. Be quiet. These people are unbelievable.
To be fair to the online left, they're not wrong to notice a double standard. The press fails to ask a lot of people this question, especially when it comes to military spending. I'm in favor of aiding the people of Ukraine with weapons, but the media never scrutinizes how we're going to pay for that, even though we are spending an awful lot of money on it. Also, the media has been complicit in Republicans pretending to care about deficits, when the truth is that pretty much no one cares about deficits. Yet the media asks about the costs of items as if there will be some political ramifications of politicians spending too much money. While there aren't any direct electoral drawbacks to politicians spending too much, there are serious consequences to doing so, and double standards aside, this is something that the online left fails to appreciate. They, of course, have their bogus framework on government spending called modern monetary theory, which they don't even understand themselves. However, I won't be addressing that today, perhaps another time in the future. What I want to talk about here is how they've convinced themselves that their big spending policy items will actually save the country money. And best of all, the online left has a set of studies that supposedly prove this. Unfortunately for these folks, much like the environmental studies that they also butcher, these studies on our healthcare system don't actually cash out the supposed promises of Medicare for All as offered up by politicians like Bernie Sanders. Supporters of Medicare for All not only claim that a single-payer system will save the country money, but that it will only provide upsides in terms of access, results, and quality of care.
So you could pay more for crappy private insurance, or you could pay nothing for the Cadillac package and awesome insurance. Okay, I don't know why you would want that choice.
Unfortunately, this claim is completely at odds with what these various studies actually say. Let's take a look at Charles Blahouse's study, The Costs of a National Single-Payer Healthcare System, which was published by the Mercatus Center back in 2018. This study got a lot of coverage in online spaces because of its supposed connection to the Koch brothers. Koch-backed think tank finds that Medicare for All would cut healthcare spending and raise wages. Whoops, wrote Ryan Grimm and Zaid Jilani at The Intercept. The top-line assessment of the study was also eye-catching, that Medicare for All would cost the country $32 trillion. That's trillion with a T, dollars over 10 years. Yes, say the progressives, but the U.S. is projected to spend $34 trillion over the next 10 years. So we come out $2 trillion ahead.
He keeps using the $33 trillion number. See, that's where that gets under my skin. And I can tell you that now, and I would have been happy to talk to him about it further. That's a Koch brothers study, and it said 32 trillion, not 33 trillion. So you're quoting a very right-wing study. But in that study, they said it saves 34 trillion. So when you only put out one of those numbers, that is, I don't know if you mean to be misleading, but you're definitely being misleading.
Lower costs with more people covered. What's not to love? Well, the problem is, the study really doesn't say this. I'll talk about this more in my next video. But for today, I want to talk about some of the trade-offs that this study says Medicare for All will bring about. So what will Medicare for All do? Well, Bernie's plan would expand insurance coverage to all those who are currently not covered, and expand government insurance to those currently covered under private insurance, hence the term single payer. Only one party pays healthcare providers, and that payer is the federal government. Furthermore, this plan expands benefits to include dental, vision, and hearing, which are usually not covered under traditional health insurance plans, including Medicare and Medicaid as they are now. It also eliminates deductibles, copays, and coinsurance. By the way, according to the National Academy of Social Insurance, 81% of current Medicare patients have supplemental plans. All of this will surely increase demand. That's kind of the point. All the people who currently cannot afford to go to the doctor, or dentist, or whatever, will surely start going now that they don't have to worry about paying for it out of pocket. That's the upside of single payer. more people will be able to go to the doctor when they need to, at least in theory. With the elimination of out-of-pocket expenses, it stands to reason that even the people who currently have insurance would seek more care. As Blauhaus writes, as a general rule, the greater percentage of an individual's healthcare that is paid by insurance, for example, the insurance's actuarial value, or AV, the more healthcare services an individual tends to buy. There is an extensive literature devoted to estimating how much individuals increase their use of healthcare as the AV of their insurance increases, which, in the case of Medicare for All, would be to an AV of essentially 100%, providing this first dollar coverage is estimated to induce 11% additional demand for those currently covered by private insurance, and 16% for those now in traditional Medicare without supplemental coverage. So, how is it that you're going to increase demand significantly, but we're going to pay less overall? Well, Bernie's plan saves money in two significant ways. First, by cutting reimbursement rates to providers by 40%, and second, by negotiating lower drug prices and promoting generics. Blauhaus states that he grants aggressive assumptions with these projected cost savings, which is interesting in its own right, but today I want to discuss some of the potential trade-offs Blauhaus brings up by doing this. Based on conversations I've had with people in the medical industry, it's apparently an open secret that you don't want your clinic or practice to accept Medicare or Medicaid if you don't have to. Apparently this is due to the lower reimbursement rates, and that they're more likely to deny a claim than private insurance. For most healthcare providers, this isn't an option because of the enormous market share government insurance already has. That's just anecdotal, though. What we do know is that, for a number of healthcare providers, private insurance keeps them afloat to offset their lower reimbursement rates from government insurance. As Blauhaus writes, the adoption of Medicare payment rates would represent a substantial reduction in provider reimbursements for care provided to everyone now covered by private insurance, though it would also be a temporary increase in physician payments for those now covered by Medicaid, which currently pays physicians at lower rates than does Medicare. For example, in 2014, hospitals were reimbursed just 89% of their costs of treating Medicare patients and 90% of their costs of treating Medicaid patients. Losses that were offset by hospitals collecting private insurance reimbursement rates equaling 144% of their costs. Back in November of 2021, Kyle had to go to the emergency room because he injured his leg. He had a horrible experience, which, unfortunately, is pretty common for people who have to go to the emergency room. It's a great reminder that, despite the fact that there are lots of wonderful people working within our healthcare system, there are some very serious problems with it, and that we are in dire need of reform. What was Kyle's solution to this?
Here's my wacky solution. Fix it. Like, nobody's even talking about this in any serious way. In any serious way. I haven't heard a politician, business person, anything. I haven't heard anybody say, you know what, we should probably increase the number of hospitals in this country by 40%, which probably is the minimum of what is needed. We're going to crusade to increase the number of doctors in this country by 50%. I haven't heard anybody say anything like that at all.
Wow, that's brilliant. I can't believe that no one else thought to do that. When you think the whole country operates like a big game of SimCity 2000, where you can just build new hospitals with a click of a button, you're naturally going to fall for some magic solution that supposedly fixes everything, like Medicare for All. Unfortunately for Kyle and other proponents of single payer, Bernie Sanders' healthcare plan would likely lead to fewer suppliers of healthcare. As Blauhaus writes, it is not precisely predictable how hospitals, physicians, and other healthcare providers would respond to a dramatic reduction in their reimbursements under Medicare for All, well below their costs of care for all categories of patients combined. The Centers for Medicare and Medicaid Services Office of the Actuary has projected that even upholding current law reimbursement rates for treating Medicare beneficiaries alone would cause nearly half of all hospitals to have a negative total facility margin by 2040. The same study found that by 2019, over 80% of hospitals will lose money treating Medicare patients, a situation Medicare for All would extend, to first approximation, to all U.S. patients. Perhaps some facilities and physicians would be able to generate heretofore unachieved cost savings that would enable their continued functioning without significant disruptions. However, at least some undoubtedly would not, thereby reducing the supply of healthcare services at the same time Medicare for All sharply increases healthcare demand. It is impossible to say precisely how much the confluence of these factors would reduce individuals' timely access to healthcare services, but some such access problems almost certainly would arise. As I understand, this would disproportionately hurt rural hospitals, making access to care in less densely populated areas even more difficult than it is now. Like I said earlier, our healthcare system is deeply flawed and does desperately need reform. As is true with any reform we implement, we don't know what the true effects will be until they're actually put into place. Medicare for All, as proposed by Bernie Sanders and championed by the online left, would be the most sweeping reform our healthcare system has ever seen. I have no doubt that there would be some upsides for some people, but there's a very good chance you'd see increased demand and reduced supply, and a worse system on the whole. Asking how you're going to pay for Medicare for All is a legitimate question, as we'll probably pay for it in one way or another.